Amniotic fluid embolism is one of the complications which the pregnant females go through whenever the therapeutic or even the illegal abortions they have gone through these phenomena. So the amniotic fluid is basically the fluid which is in the chorionic or the amniotic sac after the layers of the females of the pregnant uterus. So this fluid can enter the circulation of the mother, and it can cause the embolism in the circulatory system of the female. So this complication is very important, and we'll be dealing with this complication in this section. Basically, how do you define this amniotic fluid and how this embolism takes place? We'll be discussing that in this section. And then the causes for this amniotic fluid embolism, they're again very important. Talking about, we'll be moving on to the diagnosis. How are we going to diagnose this amniotic fluid embolism if it has been carried out in it has caused the death of the person in a mother. So in this diagram, basically, it is showing the pathophysiology behind this amniotic fluid embolism. Over here, if you see, the amniotic fluid is entering the circulation from this pregnant uterus. The amniotic fluid enters the lung circulation over here. Now we can see over here that it can cause the dyspnea, bronchospasm, cyanosis, and pulmonary edema. So basically these are the symptoms that can be seen in a living person only. This is basically the pathophysiology behind the amniotic fluid embolism. What will happen is there is a persisting neurogenic deficits, and then the cardiogenic and the non-cardiogenic pulmonary edema can occur. That will add on upon the intrapulmonary shunting, which will add on, and it will basically result in the bronchoconstriction, which is again going to result in the desaturation, and that is going to result in the dyspnea, bronchospasm, cyanosis, and the pulmonary edema. These are the signs of the pulmonary edema in a person, in a pregnant female. If she is having dyspnea, that is difficulty in breathing. If she has bronchospasm, cyanosis, that is the bluish discoloration of the skin, this means that the mother is going in the amniotic fluid embolism. That is going to be the danger signs for the physician, and he's going to basically be alert for this embolism. On the other hand, if we look over here, if the amniotic fluid enters by the maternal blood circulation, so what happens here, if it can be due to the hypoxia and the seizures, it can result in the decreased coronary blood flow. Again, that will result in a decreased intropsum, and that will result in a decreased cardiac output. So basically, this pulmonary and the cardiac causes go hand in hand, and that will basically going to result in the hypotension shock of the person. Again, if we look over here, it's basically the thromboplastin release, and that is going to result in the disseminated intravascular coagulation. So once the amniotic fluid has entered the blood circulation, we look over here that basically the thromboplastin release is going to result in the DIC, that is the disseminated intravascular coagulation. So once the amniotic fluid has entered in the circulation, it is going to end up in another complication, that is the DIC, and DIC is basically going to lead to hemorrhage. That is again another leading cause for the maternal deaths, that is the bleeding or the hemorrhage. So over here, what will happen to the fetus? Fetus will go into the fetal hypoxia, and that will result in the bradycardia, that is the low heart rate, and that is again going to result in the fetal death of the fetus. So bleeding of the uterus is the basically the final complication that we're going to deal with after the amniotic fluid embolism has taken place. So it's basically a sequence of events, a series of events. First of all, the amniotic fluid will embolize, and that will result in the DIC, and that is going to result in the hemorrhage, and that hemorrhage will be the cause of the maternal death. And again, the fetus will also go into the fetal distress and the fetal complications, and that will also again going to cause the death of the fetus. The amniotic fluid embolism is again very important. The death caused by the entry of the amniotic fluid in the maternal venous circulation, as we have seen in the pathophysiology, it is going to cause the sequence of events that is going to lead to the death of the mother as well as the fetus. So the solid elements are rarely found in the systemic circulation, and sometimes we cannot have any evidence regarding this amniotic fluid embolism. Actual fluid is blamed for the allergic response. So basically, this fluid, when it enters the circulation, it is going to start off with an allergic response that is going to basically cause the difficulty in breathing and the dyspnea that we were talking about. The cause of the DIC, that is the disseminated intravascular coagulation, it is going to even start this DIC, and this DIC is going to end up in the hemorrhage. So the causes, on the other hand, are the pelvic trauma of the parturition. That parturition is basically the labor that we are talking about. So ruptured uterus is again going to be the cause for this amniotic fluid embolism, and then any kind of instrumental interference. If even it can be in the therapeutic abortions, and even it can be in the illegal abortions that we were talking about. This instrumental interference is going to cause the amniotic fluid embolism that we were talking about. So talking about the diagnosis, how are we going to diagnose that the death of the female was due to this amniotic fluid embolism? There can be some histological causes. First of all, identifying the squames detached from the fetal epidermis. So it can be seen in the ordinary hematoxylin and eosin staining that we usually use for these histochemical slide making, and the sections of the lung are taken for this diagnosis. Now, the fibrin deposition in many organs as a result of the DIC is another histological finding that can basically help us in diagnosing the cause as the amniotic fluid embolism. On the other hand, any immunohistochemical techniques in the lung sections to demonstrate human keratin, meconium, or amniotic fluid derived mucin is again very important, and it can be one of the causes for the deaths related to the amniotic fluid embolism. So whenever we are dealing with any therapeutic abortions or any legal abortions, one of the major complications that sometimes the practitioners or even the autopsy writers have to deal with are the amniotic fluid embolism. How are we going to diagnose it? What are the histochemical slides that we are going to send to the chemical pathologist? They are very important and they have their own significance. That was the end to this section. Thank you for watching sqadia.com.